So you were at the single payers protest going on.
Yeah, I just came back from the single payer rally.
And what's going on down there?
Single Payer USA is rallying for health care at Sen Wydens' office, and a group of 5 activists they're meeting right now with Senator Wyden's staff.
They went into the building and they were allowed to come in and have a meeting,
Correct,
right?
That's
talk
right.
about single payer.
Correct,
Now, is there people outside the building?
Correct, with huge signs.
How many people are there, would you
30
say?
to 40 people, I estimate.
Okay.
Some from Jobs with Justice, but most are from a group called Single Payer USA.
Okay, thank you.
You're welcome.
Okay, bye-bye. Put your sign there. So it's the idea that single payer, that means there's one payer to the healthcare industry, right? They get paid from one person, not from a hodgepodge of a bunch of different. Do you know, in your own words, do you know who actually would finance this big thing? Yeah. What I've been told and what I've read is that just the savings alone by making a single payer, there'll be hundreds of thousands of dollars just in paper costs. So that's kind of something that I've learned. Hi.
Hi.
Do you know much about this? The single payer issues?
It's a single payer issue, and the single payer position is very simple. Everybody in, nobody out, no co-pays, none of that. Eliminate the bureaucracy, save money, cut out profit. We're all happy.
Yeah. Now, I asked him if he had an idea on maybe how would single payer be financed? All this healthcare that's free, who's paying for that? Who would be paying for that?
Well, you consider, the amount of profit that's, goes into the healthcare industry now, the amount of inefficiency that goes into the healthcare industry now, the amount of time and effort that hospital billing people have to put in, filling out, insurance company A's form, insurance company B's form, and everything like that, that there would be a lot that's saved. And other than that, I say, since the insurance companies can rescind health insurance policies, let's rescind the TARP. Make those suckers give their money back.
Say that again about the TARP?
Let's rescind the TARP. If health insurance companies can rescind health insurance policies, why can't we rescind that? Well, let's start dinging those congressmen and legislators so that they start feeling the pain. Of course, we can only do that via elections and referendums and things like this, but there's a lot of room for creativity here.
Yeah, I'd heard the same thing as it would pay for itself just on the waste that's in the system now and all the paperwork, that if you cut that out, that would be almost enough just to pay for the...
Almost enough.
Yeah.
I've heard that as well, but I say let's rescind the TARP.
And by rescinding the TARP, I don't know nothing about the TARP, but by rescinding it, that's what is TARP in a nutshell?
Toxic acid relief program. It was the one to bail out the banks, U.S. Bank, Citibank, Wells Fargo, all of those. The ones that are jamming up, the credit card rates, not giving any loans, so that the economy just is going down, 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 and they have all their money. So let them give it back.
So instead of giving it to that hole that just goes into nowhere, the black hole, use it to pay for this system here, the single payer system.
Don't support social parasites, give us health reform that works.
Okay.
And we can do it, and it's possible.
Good.
But
you gave me a lot of information. I'm putting this on Indie Media, Portland Indie Media, so...
Hey, pleased to meet you. My name's Claudia.
Hi, Claudia. And I film as Joe Anybody, so if you see Joe
hey,
Anybody...
I've seen your website.
Okay.
Hey, pleasure.
Okay, you
Honor
betcha. Good.
So they all said, here to sign. So
All right. Everyone covered. Yeah.
Because people promised us. legal papers. I had a break.
All right. Well, thanks everybody for being here.
Where are you from?
Portland Indie Media, and I have a website, Joe Anybody. So
Another protest on July the 2nd here.
right here at Wyden's office. Do you believe?
Let me double check and see what the information said. July the 2nd at 12 noon. The following Thursday.
So the
it's
July
like,
2nd.
At 12 noon.
Uh-huh.
Children's March for single-payer health care is planned for midsummer.
Would that be right here then?
That would, I don't know about the Children's March,
Oh.
but this other one I assume is here.
Okay, good. Okay, thanks.
You're welcome.
Okay.
Well, I was dehydrated.
We made our points. Yeah, why don't you grab so I don't have to talk to Debbie.
Let's walk down that way a little bit.
Yes, this is our leader.
Somebody start talking.
All right, we met with his representative and we talked about single payer and why single payer is the only option that will work and cost-wise, and they listened. We talked about the fact that the polls are so strong and that people are willing to, when they're concerned, they're losing their health care and they're willing to change over, and listen to that.
Who did you meet with, Loretta?
Barbara,
Okay, I don't know Barbara.
We also asked for Senator Wyden to use his clout as a senator to request real polling on the issue of single payer, to actually ask the American people straight up whether they're willing to throw out the for-profit healthcare system that we have now and replace it with a government-funded system like the rest of the world enjoys. And they were receptive to that.
The other thing we asked is to see if he would be willing to sign on with Senator Conyers as a co-sponsor of the single payer bill. So
What did he say? He'd think about it?
there was no response.
Oh, yeah.
Did you tell him that the proposal to have a state-by-state option, single public option, that was unacceptable? You didn't get that in. Okay, well,
It was on our agenda.
but get that in. That would be 51 battles instead of the one battle we have in DC.
right. So many of the ideas like the triggers and the co-ops and all that actually are ways that are going to sabotage that it's actually going to work. And single payer really is the only way to do it. To throw out the for-profit companies, and so we don't have such high administration and CEOs and stockholders and all those costs.
Right.
And then we put that into healthcare.
But what was said about like Wyden's